It's really wonderful to see so many of you who I've become friends with, who brought other friends and colleagues to this event. We do like to share what we've been working on at this annual breakfast, but we also really want to engage people in the work that we do, because we are totally committed to having community voices in our policy work, because we really think it's important as we try to strengthen outcomes for children and families in New Jersey. So as Jennifer said, on your table is our annual report, and that highlights some of our activities. Our NJ Votes for Kids campaign focused on childcare, maternal health, and positive youth development. As shown in the video, which you have yet to see, the gubernatorial candidates, the two main candidates, did make a commitment because of all the voices of many people in this room and in our network and our partners to make childcare a priority. All right, and so that is going to be our focus for 2026, to hold our governor-elect accountable and making sure that she continues with that commitment to prioritize childcare. Because, okay. All right, because we do need a strong childcare workforce if people are going to feel confident that they can leave their children at a childcare center and go off to work. And in case you haven't heard, our Director of Early Learning, Policy and Advocacy, Winifred Smith-Jenkins, who's standing in the back of the room, and a colleague of hers, Megan Tavermina from, we always call it NAJC, it's the New Jersey Association for the Education of Young Children. Megan's over there somewhere, I had to write that out. They have actually been selected to be on the transition team for Governor-elect Sherrill and the education work group. So. As we all know, 2025 has brought some serious changes, okay? Some people think we are in a continuous state of crisis, all right? And especially for those people in this room who actually work with children and families and with low-income individuals, it is like every day something is changing and you feel like you just got slammed again, right? So I do think, though, that we can't stay in that sense of continuous crisis. I think crisis brings opportunity, or it should bring opportunity. And it brings opportunity to reassess how we do things. Maybe we could fine-tune programs. Maybe we could work with other partners. But we do need to reassess how we do things. I think it brings opportunity for more creative approaches, all right? For people like me who've been in this business for more years than I like to count, we can always do things differently. We can always improve how we do things. And there's a whole younger generation who's coming forward who I know on my staff, sometimes I struggle with it, but they have a faster way to do things, an easier way to do things, and we should try to embrace those changes. It's definitely an opportunity, if not a necessity, for collaboration. And I do hope that everybody here takes the opportunity to meet a person that maybe you could work with, maybe another organization in your community, because I do think we need more than ever to collaborate. To me, complaining and pessimism has no place in ensuring that every child has a chance to grow up safe, healthy, and educated, right? Action is needed, and that's what we want to be about as ACNJ in 2026, and we hope all of you want to be about action as well. The federal changes to the Supplemental Nutrition Assistance Program, or as we call SNAP, and to Medicaid and potentially Head Start and other federally granted programs are changing. But those changes are coming. We can't say they're not coming. The laws have been passed, the policies are being written, the regulations are changing. We need to work together to ensure that those changes are implemented with the least amount of harm to children and families. So what does that mean? From my perspective as a person who's looked at children's health issues for many years, I really do need people to understand that Medicaid impacts everyone in this room and everyone in the state. People will say, I'm on New Jersey Family Care. But people don't understand that New Jersey Family Care, New Jersey Family Care is Medicaid, okay? And 20% of New Jersey residents are on New Jersey Family Care. 830,000 children are on New Jersey Family Care. It is the program that supports our children's system of care, which is the state program within the Department of Children and Families that provides services for kids who have emotional and behavioral problems. It is the funding that provides health services to over 90,000 children in our schools. Half of the schools in New Jersey use Medicaid funding to provide health care services in the schools. All right. So as these changes are implementing, and there's I think about 550,000 adults who are part of what they call the Medicaid expansion through New Jersey Family Care, that's the target population that the changes are looking to impact. And if those people do not meet their work requirements, which are not difficult, but sometimes people who have complicated lives have a problem meeting them or documenting that they've met them. So they could be working, it's 80 hours a month, 20 hours a week, or they can be in school, or they can be volunteering. But if your life is chaotic and you might not know where you're sleeping the next day, sometimes you don't think that you got to get your work documentation to a certain office. But that funding, if they are determined to be ineligible, impacts all our other Medicaid programs for children. Okay? So it's really critical for people to understand that and to make sure that if you know somebody who's in New Jersey Family Care, or you know somebody, a senior, who's in assisted living or a nursing home that's also being funded by Medicaid, that those stories are told to our policymakers, members of Congress, the New Jersey legislature, because they are going to have to make some budget decisions, which is going to impact that funding. Now do I feel like now I'm being a downer? Sorry. Okay, but I do think it's possible, and I think if we collaborate and we work together, we can make sure that these people meet their work requirements. And that is required for the SNAP benefit as well. So I know, where are the community food bank people? I know there's some people here, okay? I know they're working hard to make sure people whose SNAP benefits were jeopardized, that they still had those benefits. I know my friends at Patterson Alliance and some of the other child care people. Everybody can make sure that people understand what is now required, that everything is changing, those requirements are changing. So I would encourage you all to stay informed. If we had the video, you would see that we have a series of lunch and learns. Every month we have a different topic. Sign up for them. You can also go to the website and you can download them, you can watch them, you can share them. That's how we get updates out to the community. All right? We continue to share our data through our Kids Count publications, and I'm happy to say for anybody who's in real South Jersey, and I know Eric is here, okay, all right. We are on December 12th publishing the Camden Kids Count, the first one we've done in over 20 years, okay? So, happy about that. And there will be another county pocket guide the beginning of next year, and we'll be doing the Newark one again, all right? So, the main thing, though, is the Start Strong New Jersey campaign. All right, and that, as I said, will be our focus for 2026. So I really would appreciate if everybody took your phone and scanned the QR code in the plastic or on the screen here behind me and join the movement, sign up for the campaign so you can get additional information and stay informed. As we really work to make sure that we have a trained, stable workforce that is adequately compensated so that parents can feel safe and secure when they leave their children at the child care center and go off to work. Okay, so the other thing that always happens, except for the video that may happen later, is we always have some type of panel. And as Jennifer acknowledged Richard Trank used to always say, if you bring people together, they should at least learn something. Right? So we always have a panel. This year's panel is focused on maternal health. And I am happy to say that one of our thought partners in our early learning space and one of our funders, Atia Weiss from the Burke Foundation, was kind enough to say that she would moderate this panel. I just want to say a little bit about Atia. So Atia, who is the with the Burke Foundation. She's the executive director, has some of her team here with her. And with their team, they have really worked diligently over the past several years to co-invest and advocate for evidence-based models that deliver relational-centered care, such as Family Connects, a universal home visiting program that is now rolling out statewide and available to all new parents in New Jersey as it rolls out, and funded initiatives to support expanding Healthy Steps in pediatric care and Centering Pregnancy, which is a group prenatal care model that has been proven to improve maternal and infant health outcomes. Atia herself, though, spearheaded the creation of the First 1,000 Days Policy Coalition, which was her plan was to improve maternal health outcomes and help build a sustainable infrastructure for New Jersey's child care system. And with that, looking at paid family leave, also looking at maternal health, and then supports for families. It is my honor to turn the microphone over to Atia Weiss, who together with her partners at the Terrell Fund and our early learning funders, who I see over at a table over there, who can all wave and say hello, have been supporting the Start Strong campaign for New Jersey. So Atia, you want to come up and introduce the panelists? Thank you all.